Hi everyone, I'm Yo and this is Virginia. Welcome back to our YouTube channel, Knowing, Caring, and Loving Your Lady Parts. So today we have an important fundamental video for you about posture. And of course, postural alignment is really important to prevent neck, back, shoulder pain. But because everything is connected, it's really important also with respect to optimizing your lady part or pelvic floor and increasing your overall pelvic and sexual health. So let's get started. If you're new to the channel, please don't forget to hit that subscribe button and let's get started about talking about postural alignment. So having proper postural alignment is really important to prevent neck, shoulder, back pain. But because everything connected, it's also very fundamental in terms of optimizing your lady part or your sexual or pelvic health. Now, with respect to your spine, there's a certain alignment that is optimal. And let's go over here, and we have a new friend here, and our new friend's name is Skelly. Everybody, welcome Skelly. So Virginia's gonna have a little rest here. We'll put her over here while we use Skelly today. So let's take Skelly here, and let's look at the natural curves of her spine. So normally you want to have a slight concavity of your neck area. This is called the cervical spine. And then further down, this is called the thoracic spine, the upper back area, and it's convex, so it goes the other way. And then down here in your lumbar spine, there is another slight concavity, and that's the lower back. So you want to maintain a slight concavity in your neck area, the cervical spine, and in your lumbar spine, your lower back. So a lot of times physios will talk about maintaining a slight lordosis in your lumbar spine, and that's what they mean. So that are the natural curves of your spine or skeleton. If you look at this diagram here, it'll show what is the optimal alignment. So you don't want to be too bent over like this. This is called kyphosis, because what happens in this position is it puts a lot of stress on your muscles, as you can see, right? So Skelly doesn't have any muscles attached. So if you look at this diagram here, there's a lot of muscles attached to the skeleton. So if you're like this, what happens? Things get stretched, this gets shortened, and it's just not balanced. It doesn't look very comfortable either. The other thing is that you can't take a big breath because everything is squished in. So you don't want to be too far forward like this diagram here on the second picture, and you don't want to be too much into extension, which is like this, because what happens there is it pushes the joints here, and there's little joints called facet joints, and if you compress them too far by going backwards, that can cause a pinching or compression or a kissing of these facet joints, and that can bring on pain. So yes, so you want to be in the middle in terms of a nice postural alignment where you're maintaining those curves of your spine. If we use Skelly's friend Scully and we demonstrate the kissing of the facet joints, so if you see here, there are joints here called the facet joints, and what happens is if you go into too much extension, these little joints here can actually compress or kiss together, and you can get that pain as you go back. This isn't very flexible right now. She's a little bit old. So having good posture will have a multitude of benefits, not only for your neck, back, shoulder, and hip, and all the areas that connect to your spine, but also for your pelvic floor, your lady part region. So remember, the pelvis here, right, attaches to, as you can see from Skelly, right, the sacrum, which is a tailbone, attaches to the bottom of the lumbar spine, and also those pelvic floor lady part muscles are right where the pelvis is. So if you don't have good postural alignment, as you can see, you can throw your muscles off in terms of their length or tension, and they won't contract as well depending on your alignment of your pelvis. And of course, if you're tilted one way or the other, that can also affect your muscles. So you want to maintain a good postural alignment so you can optimize the recruitment of these important muscles, the pelvic floor muscles or lady part muscles. So what is your optimal postural alignment then? So you don't want to have too much bent over position, which is called kyphosis, and you don't want to be too much extension. You want to be just right in the middle. And just giving you an example of why this kyphosis position doesn't work also. So with respect to pelvic floor, remember, and breathing, remember you want to optimize your breathing pattern, that umbrella breathing that I talked about in the breathing video. You want to make sure you have good postural alignment, because if you're in this position here, that'll scrunch everything up. I'm just going to show you with the ribs, okay? So the ribs attach to this area here, like this, and with breathing, the diaphragm attaches to the rib. So if you're all scrunched up, what happens? You can't breathe as well, and the pelvic floor works optimally with the breathing pattern. So you want to make sure that your ribs can expand well and they're not all scrunched together, and also of course your lungs, because you want the diaphragm to be able to work optimally with that pelvic floor muscle. So some tips on how you would get to a proper postural alignment is try to stand with your ribs over your hips. So not too far forward and not too far back. So they just be slightly over your hips, and then you have a slight lordosis of your lumbar spine and of your neck area. So that's the optimal position. Sometimes I've seen people, and this sort of works, you know, those ski jumpers, right? Those freestylers, where they do this and they start off in this position here, right? And they're not real. So you can start off like this position here, but then you take it back a little bit because you don't want to be that far forward, and that's your optimal alignment. The other cueing I find that works really well with clients is think of someone pulling you by the top of your head. So I actually put my hand there, and then by that tag of your pants, and that creates that sort of postural alignment that you want. So the tag will create that lordosis in your lumbar spine, and just cueing people to stand tall. And then when you're in that position and you're a good postural alignment, of course, that opens up things here so you can breathe with expanding that diaphragm that works with the pelvic floor member at the bottom. So with the umbrella breathing that I talked about. So if you're standing in that good postural alignment pattern, that will facilitate the diaphragm that'll work with those lady part muscles, and also that'll create a symmetry with your hips and with the rest of the area of your body, because as you know, there are many muscles attached to the hip area that lie very close to the pelvic floor, if you can see in this diagram here. So it's important that your pelvis is as level as possible and not tilted too far forward or back. I want you to try this quick example of why you need to maintain a good postural alignment, especially in your pelvis with respect to recruiting the pelvic floor muscles. So try sitting, and I hope you can see my spine here. So try sitting slouched. So I want you to slouch down like this, okay? And when you're slouched like this, your pelvis is like that. You throw everything forward, which really doesn't feel good for me right now at all. But try to do what's called a KEGEL, or recruit those pelvic floor muscles. Remember that in and lift as you breathe out. And where do you feel it? You usually feel it in the back. And these muscles are stronger, and often you want to make sure you get the front part of the pelvic floor, called the anterior sling. So then sit up straight, so you're in this position here, in a better alignment or optimal alignment, okay? And now squeeze the pelvic floor. And where do you feel it? You feel it more in that front part of the pelvic floor, which is often where people are weak. And that's really important with respect to stress urinary incontinence or any of that leakage when you're doing any high impact or compression type activities. So if you stand or sit with your pelvis in optimal alignment, so not tilted too far forward or back, and your ribs are slightly over your hips, that creates that optimal alignment. So things aren't thrown too much forward, and in a nice recruitment pattern for your muscles to pull as effectively as possible. And that creates your optimal alignment pattern for the pelvic floor or lady part muscles. So in summary, amazing women and men out there, if you're listening, to maintain an optimal postural alignment, you want to try to have your ribs over your hips slightly, And think of reaching up nice and tall to the top of your spine, and maybe a tag at your pants to maintain that curve, your lordosis. So you're in this good postural alignment, and then your pelvis should be optimally level, not too far forward and not too far back, and that'll create an optimal alignment of your pelvic floor and will optimize the recruitment pattern of these muscles, which are really important for your pelvic and sexual and overall health. So Virginia and I and Skelly, thank you so much for tuning in today for our video about postural alignment. Please don't forget to hit that subscribe button and tell your friends, and we so look forward to seeing you again soon.